what types of treatments does interventional radiology offer?
Interventional radiology provides a long list of minimally invasive interventions for vascular anomalies. For example, for low flow malformations such as venous and lymphatic malformations, we commonly, almost on a daily basis, perform sclerotherapy, which is basically accessing the malformation through a skin without making an incision or a cut down, and injecting these malformations with certain medications that would cause the malformations to shrink or disappear. This will leave the patients with no surgical scars, and the recovery is certainly much quicker than any alternative treatment. For high-flow lesions, such as arteriovenous malformations, we provide another tool of closing the abnormal blood vessels, or the abnormal connection between the abnormal blood vessels, such as embolization, just basically navigating through the vessels inside the body and closing the ones that are connecting to the other vessels abnormally. We also are included in the diagnostic part of some of the challenging malformations or the rare forms of tumors. We do perform image-guided biopsies, which means that you obtain a small specimen of the malformation. This is typically purely diagnostic, particularly for the atypical malformations or for the very rare malformations presenting in an unusual way. Several other treatments include using the laser technology, such as the dyed laser for closing abnormal veins, or evaporating parts of the abnormal skin, and the patient will eventually heal, again, without leaving a skin graft or stitches in the skin. These minimally invasive treatments are done typically as a day surgery work, which means that the patient will be discharged home the same day. They're almost all done under general anesthesia, and they require an advanced workup and planning. And we use the imaging tools, such as ultrasound and real-time fluoroscopy, to guide us through the body and into the correct spot without incurring any damage on the normal tissue around it. So it is actually one of the major advances in the management of vascular anomalies, where the more invasive surgical tools are now replaced with less invasive tools that requires or leaves less burden in the patient for the long term. Therapeutic treatments offered by the interventional radiology is basically determined by the type of malformation that we're dealing with. For low flow malformations, such as venous and lymphatic malformations, we perform the minimally invasive or percutaneous sclerotherapy, which basically means guided by the imaging tools, we access the malformation through the skin without the need to create a large incision or surgical cut down. So sclerotherapy for the low flow malformations, and for the high flow malformations, we perform embolization, which is basically navigating through the blood vessels internally, again guided by the imaging tools such as real-time X-ray, and closing the abnormal connections or the abnormal vessels through using tiny small tubes introduced into the body. We call them catheters. This is for the high flow arteriovenous malformations. In addition, we use the laser technology, such as the dyed laser treatment, delivered through a tiny little wire, which is flexible and introduced into the abnormal vein through the skin, and that will destroy the vein and make the vein vanish over time, again without the need for making a larger cut down over the vein or doing anything more invasive than a tiny little entry point, which is less than a couple of millimeters. For the diagnostic part, we also perform percutaneous biopsies, which is a less invasive form of obtaining a small sample from the patient's abnormal tissue. This is done by special devices. They look like needles, and we call them biopsy devices that are guided again by imaging and would leave literally no scarring. The other form of diagnostic tools is angiography and venography, which is basically introducing small catheters into the body and injecting X-ray dye or contrast. That can map out the normal and the abnormal blood vessels and can show the internal changes within these blood vessels that are not easily detectable by looking at the patient and examining the patient clinically. Those are unlikely to be done these days for pure diagnostic purposes. Angiography, for example, which has been replaced by the less invasive imaging tools such as the MRI.